Surgeons at Johns Hopkins Medicine submitted a letter to the director of the Centers for Disease Control urging the CDC to include medical errors in their annual list of leading causes of death. The letter follows an extensive study that concludes that preventable errors are in fact the third leading cause of death to Americans. So this study was published in the BMJ, which is a medical journal, that just this past Tuesday. And one of the lead author of this is Dr. Martin Makary. He's the surgical director at Johns Hopkins Multidisciplinary Pancreas Clinic. He's the professor of surgery. And he's expanding on an already existing study that had been done back in 1999. And it was an Institute of Medicine report that called preventable diseases an epidemic. And it actually cited that there were about 98,000 deaths per year as a result of preventable errors such as poor judgment, miscalculation of dose of medicine, the type of medicine, et cetera. And so Makary's research actually goes quite a bit farther. It's comprised of 4 large studies over the course from 2000 to 2008. It incorporates research from the Health and Human Services Department Office, the Inspector General, and the Agency for Healthcare Research and Quality. What did we find? Well, apparently there are about 250,000 deaths each year as a result of preventable medical errors. That is just behind heart disease and cancer, and just before respiratory disease. So it actually boils down to 700 people a day. This is as a result of surgical complications, mix-up of doses, as I said, et cetera. So it's kind of crazy because, and the reason why Makary is wanting the CDC to add this as a list, add this to the list of preventable or to the causes of death is because there's not a lot of attention on it. There's not a lot of awareness. Generally speaking, the coding that the CDC uses, it's based on the treatment that people were seeking. So for example, if someone is seeking a cancer treatment, but then there's some kind of preventable error that takes place and that's actually what kills them, on their death certificate, they'll still list cancer as the cause of death.
Right. But at the same time, it's really hard, right? Mm-hmm. You can't, the people went in there because they had a serious injury or an illness. So somebody gives them the wrong medicine or something and they die, well, what do you use as the actual cause of death? Well, they went in there for a certain reason. So I understand why it's a tricky, yes, it's not just yes or no, black or white.
Right, and I totally understand that. There's obviously, issues of insurance. I mean, and the liability on behalf of the doctor, the nurse, et cetera. At the same time, without that information there's not a lot of, what Makary cites is the fact that it hinders research, it keeps this kind of information under wraps and people don't know. Makary actually had this to say. He says, you have this overappreciation and underestimate of things like cardiovascular disease and a vast under-recognition of the place of medical care as the cause of death. That informs all our national health priorities and our research grants. So I think that's what it is. It's like if you don't acknowledge the problem, then there's no way to really throw money at it or to throw the kind of research that you need.
And I don't think there will be a need for this discussion in, let's say, 20, 30, 40 years. I mean, if we see the way that, look at how rapidly technology is changing every game, not just the medical game. I mean, look at self-driving cars, everything. We're reducing human error. Why? Because humans are doing less. We're going to replace that with robots and other technologies that prevent human error. There's no place for human error in an autonomous vehicle, for example. You type in your destination and you sit back, cars communicate. I have a feeling, hospitals might be seeing the same thing, the same way factories and other places are seeing.
Yeah, exactly, because if you're talking about mixing up doses or the types of medication, a lot of that's clearly human error. Even just a resident nurse that's coming in there, misdiagnosis, I suppose, is the same thing.
The self-checkout at CVS never gave me accidentally like an extra buck or something, right? That's never going to happen.
Well, and another thing to point out is, so Bob Anderson, he's the chief of mortality statistics, that branch of the CDC. He says that it would be a little bit difficult. So not only is it just kind of awkward or uncomfortable for a doctor to list, human error as the reason that somebody dies, but also that the coding allows those statistics to be compared with other countries. So in order for it to be, it basically would have to be this like vast sweeping reform that he says, you would only do if there was a compelling reason to do that. But I think this study certainly, proves that there is a compelling reason to do that. Another consideration is the fact that there's a variety of care delivered. It's not, the way that healthcare is handled in this country, it's not quite as standardized as, for example, getting on an airplane or dealing with airline protocol. Kenneth Sands, he directs care quality at Beth Israel Medical Center, he he points to that as well. He says there has just been a higher degree of tolerance for variability in practice than you would see in other industries. When passengers get on a plane, there's a standard way attendants move around, talk to them, and prepare them for flight, yet such standardization isn't seen at hospitals. That makes it tricky to figure out where errors are occurring and how to fix them. The government should work with institutions to try to find ways to improve on this situation. But I mean, I think certainly the first step is just the knowledge. I mean, I would have never thought that medical error was the third in line after, you know.
Right, and changing the cause of death, like you said earlier, for insurance purposes, I mean, I would imagine these hospitals would go out of business. All of a sudden, we're having hundreds of lawsuits every single day. Someone's cause of death is the doctor accidentally doing this or doing that. Okay, leaving an instrument in someone's stomach when you're doing a surgery, okay.
Yeah.
But you know, if we're going to get into the details of things and smaller errors, well, then they could potentially have a lot of lawsuits on their hands. You know, someone losing a loved one to them getting the wrong medication or this or that. Or
right, exactly. And I think that's the fear that
really
the medical industry has of adding these kinds of stipulations.
Yeah.
At the same time, it's like, what's the alternative? 250,000 people are dying a year because of preventable things. You know, there's got to be more research. There's got to be more grants thrown there, and I think that's what this research proves. So this whole story speaks to another Institute of Medicine report that says to err is human.